Hi, I'm Dr. Khurrum Shaukat Yusafzai. Today's video is about the doctors who don't know about hyperbaric oxygen therapy. And there was an interesting study held in the continent of Europe where they tried to determine how much the doctors know about hyperbaric oxygen therapy. So they conducted a survey by sending questionnaires to the doctors. There were about 1,500 doctors according to the European database on the island of Malta. So on the island of Malta, they sent emails to each and every doctor which were registered with the medical authority. So they received a questionnaire, and the questionnaire is something like this. In this questionnaire, there were questions related to the hyperbaric medicine, that why they want to refer a patient to a hyperbaric oxygen therapy unit, or why they won't, and what are the main indications of hyperbaric oxygen therapy. So this was very interesting because through these questions and this information collected, a lot of scientific data was collected, which was analyzed and inferred upon that what it really means. The results were astounding. As the questionnaires were only filled by 150 doctors out of 1,500 doctors who were there on the island of Malta, and there are actually three hyperbaric chambers on the island of Malta, and the doctors were mostly graduates of the University of Malta in medicine, but there were about 20 to 30% doctors who were coming from Canada or some other place. And these doctors had different universities where they had attended. And the doctors were also divided almost equally between the male and female sexes, and the number of male and female were in the same ratio as there are actually in the whole of Europe or on the continent or the island of Malta. So this uh, research, which was conducted to know the knowledge of the hyperbaric medicine among the general doctors, who were divided among different types, the general practitioners and the specialists. And they were divided also according to their age, starting from below 35, which were a lot. And there were some senior doctors who were having a lot of experience, and there were consultants and specialists, and there were general practitioners. So the questionnaires, when returned, they contained some useful information which was analyzed, and after the analysis, it was found out that the female doctors are not as ready as the male doctors for referring the patient to the hyperbaric medical unit, which was another surprise because the male doctors, they were referring the patients more. And furthermore, the male doctors who were doing scuba diving, they knew about the diving and the diving related hyperbaric oxygen treatment. And also the doctors who had visited the hyperbaric chamber in their lifetime, who are actually seen a hyperbaric chamber and seen its working, they were more ready to refer the patients to the hyperbaric consultant, because there were a lot of hyperbaric consultants and trained nurses and technicians on the island of Malta who were manning the hyperbaric chambers. And the data also showed that the doctors who had attended some sort of lecture in hyperbaric medicine were more ready to refer the patient to a hyperbaric doctor. So three factors determine it: the male are more prone to refer the patient, the male doctors are more prone to refer the patient to the hyperbaric consultant. Second, those males who are actually perform deep sea diving or scuba diving, self-contained underwater breathing apparatus, they are more prone to, rather they are 6 to 7 times more prone to refer a patient to the hyperbaric consultant. So this was really interesting. And those who had seen a hyperbaric chamber, they were also more than 5 to 6 times more prone to refer the patients to the hyperbaric consultant. And there was another category of doctors who had attended the lecture and they know something about the hyperbaric medicine. They were 3 times more prone to refer to the hyperbaric consultant the patient for different ailments because they had some knowledge about the hyperbaric medicine. And even in the University of Malta, they are actually taught about hyperbaric medicine more as compared to the other universities all around the world. And this is one of the reasons the doctors don't know. I had a video about that most of the doctors don't know, because uh, when they are in the medical college, they just read a chapter in the physiology guidance and they readily forget this when they are going, becoming senior. And this was also demonstrated by the study that the more the number of practice they have, for example, the specialists, they become in a narrow field. Like instead of the general practitioner who practice wide variety of disease, the specialists are narrowed down to their own particular field. They are less prone to refer to the hyperbaric consultant because they have narrowed down to their particular specialty. So the young doctors who are below 35, they were more prone to refer as compared to the senior ones. And things are changing, but still the doctors have no knowledge. And to conduct seminars, to let them visit the hyperbaric chamber, and also if they can perform deep sea diving or scuba diving, they're more understanding and more open to the idea of hyperbaric oxygen treatment. So, what were the indications in the questionnaire? There were actually a question about what are the indications of hyperbaric oxygen therapy. And so there were actually a couple of European Commission of Hyperbaric Medicine, ECHIM. This European authority which controls the number of diseases which are treated, and the insurance company also pay for them. These conditions were known to the doctor and they're supposed to know. So, interestingly, there are some marked with the red, which are the emergencies. Um, so, these were the ones they knew about, but they didn't know about the other ones like sensorineural deafness. Like when you have deafness, you can be treated by hyperbaric oxygen treatment. And the ECH, the European Commission of Hyperbaric Medicine, allows hyperbaric medicine to treat that, although it's not done in America, but in Europe it is allowed. So you can see in the graph that the doctors know about them, but the number of doctors who know about the emergencies are more, but the other indications like diabetes, foot, wound care, and other, their knowledge was less. So that was pretty interesting. And this no this reason for their reluctance to send to hyperbaric consultant was also found out through this data, that more than half of them had no reluctance. Like more than half of them had no reluctance, but somehow because of their lack of knowledge, they were not sending. But when they understood that hyperbaric oxygen therapy can help, they were ready to refer and also refer it again in the future. But the other 50%, they were among them, 15% are those who really thought maybe it won't work. So among the other 50% who are not who are having doubts, 15% of those were skeptical of the results, which is wrong. It's not scientific, it's their personal bias. And there were 10% of people who actually did not know, 10 to 15%, that where to refer for hyperbaric treatment, because they had no knowledge of the location of the hyperbaric doctor and the hyperbaric chamber. So they had this reluctance because they did not know it existed or where it was. So this is another 10-15%. And then there are the other 10% who think of the other various reasons, which you will see in the graph. um, like you can it's very interesting that most of the people, majority of the people, as through the study has been demonstrated, have lack of knowledge of hyperbaric oxygen therapy, and they have lack of knowledge of what diseases they can treat. So they would actually uh, have lack of knowledge, and when they have knowledge, then the problems of the insurance coverage and the location of the doctor and where to send logistics and other stuff would come in. So this was pretty interesting, and I showed you people this interesting study because if you go through it now, you would then understand, especially my patients, when they go to the other doctor, they do not send them to a hyperbaric doctor, even they know, they have seen, or they know where the chamber is and where the doctor is, but they're reluctant to send them because they're not sure themselves. They suffer from lack of knowledge, and they suffer from lack of knowledge of the diseases also, like which disease particularly are treated and how much effective it is. Then comes the issue of the cost as well, like they're not sure about the cost. Like most of the doctors in this study were not understanding that, for example, in the diabetic foot, the cost for hyperbaric chamber is lower than, like if you do hyperbaric chamber and you recover your foot and you have a comfortable life, the cost is lower. But if you don't do hyperbaric oxygen therapy and you have diabetes, then you end up having an amputation and a lot of surgeries and medicine and in prevention from infection that is more costly than the hyperbaric oxygen therapy. So most of the doctors did not knew that, and especially in Europe. So this is all about the continent of Europe. I will try to bring a similar study about the lack of knowledge of doctors in the continent of America, because America is strange. Like there are a couple of doctors who are good in hyperbaric, but there are a lot of doctors who are really bad, and their understanding of hyperbaric oxygen therapy is not really good. So interestingly, I will bring similar research happening on the hyperbaric knowledge of the journal practicing on the specialist and the consultants. And I hope you like my video, which I have brought after a lot of research. And I hope you like my video, and yeah, I hope you subscribe to my channel and also press the bell icon, because without that you will not be able to see me again, because there are billions of videos out there. And if you want to be notified, press the bell icon. So if there are any comments, please leave the comments down below. I would be gladly able to answer. And if you want consultation or anything, I will be available with the prescription and also nice consultation and booklet of instructions. So I hope to see you soon. Take care. Goodbye.